Hello everyone! This is a synthesis of the module regarding hepatobiliary diseases. The hepatobiliary system is made up mainly of the liver, gallbladder, and pancreas. Anything that affects these organs will bring about different kinds of diseases. Let's begin with the inflammation of the liver, or hepatitis. In general, etiologic cause of hepatitis could be viral or non-viral. For the non-viral etiology, we can further divide it into either caused by excessive chronic alcohol consumption, producing an alcoholic liver disease, or others in which we call it non-alcoholic fatty liver disease. What happens during an alcoholic liver disease is that the excessive alcohol present in the body will take its toll on the liver. A normal functioning liver can degrade ethanol, the specific alcoholic compound that is present in alcoholic drinks, into acetaldehyde, furthermore into acetate, and finally acetyl-CoA, in which our body will use to produce ATP. The liver is able to do this with the aid of the enzymes alcohol and acetaldehyde dehydrogenases. However, when alcohol consumption increases even moderately, fat starts to accumulate in the liver cells. How? Remember when you catabolize alcohol into products that are useful in the body like acetyl-CoA? Well, it also generates certain byproducts like NADH. The NADH increases lipogenesis while decreasing fatty acid oxidation. This is tolerable at low levels, but when ethanol levels increase, fat deposition in the hepatocytes also increases. Thus, the more you drink, the more small fatty droplets accumulate, which eventually will coalesce and become large droplets. The liver becomes fatty, also known as hepatic steatosis, which is the first stage of liver damage in alcoholism. Continuous consumption of alcohol will further damage the liver, progressing the damage from hepatic steatosis to steatohepatitis, wherein there is now swelling of hepatocytes and even necrosis. And neutrophils would permeate the hepatic lobules, accumulating around degenerating hepatocytes. When the alcohol consumption continues in a long, uninterrupted time from this point, the damage advances to steatofibrosis, where sclerosing arises first from the central vein, spreading all throughout the surrounding hepatocytes in a chicken wire fence pattern. This state, and even the state of steatohepatitis, can ultimately lead to cirrhosis, where the damage becomes irreversible. Before a liver becomes irreversibly damaged, the best approach to managing alcoholic liver disease is a complete alcohol abstinence. Another non-viral cause of hepatitis is called non-alcoholic liver disease. In a similar way to ALD, it progresses from a normal liver to hepatic steatosis. However, the cause is simply not a chronic excessive consumption of alcohol, but of other factors, most especially obesity or overweight and insulin resistance. This can also end in cirrhosis, where the most important management approach is to manage its causes, the associated comorbidities, and complications of advanced disease. Specific therapies for the disease includes a regimen of diet and exercise, pharmacologic approach, and bariatric surgery. Going to the viral causes of hepatitis, which is mainly due to hepatitis viruses A to E. In a nutshell, these viruses causes hepatitis in different ways and extent. Starting with hepatitis A. Hepatitis A infection is obtained through fecal-oral route, which usually resolves on its own, and with vaccines available for prevention. Hepatitis B, which can be transmitted parenterally and sexually, can both cause acute and chronic infection. These infections can be made more severe with a concurrent infection with hepatitis D. Hepatitis D only becomes pathogenic in the presence of hepatitis B infection. Co-infection with hepatitis D can happen during acute hepatitis B infection, while superinfection with hepatitis D can occur when the virus superimposes later on in a chronic hepatitis B infection. Treatment for both infection is an interferon. Recombinant vaccine and hepatitis B immunoglobulin are available for prevention. Another parenterally transmitted infection is hepatitis C, which usually manifests as a chronic infection. chronic infections with hepatitis B, D, and C can progress into cirrhosis, which, again, is an irreversible damage to the liver. Hepatitis C infection can be treated with pegylated interferon. However, no vaccine is available for prevention of this yet. Lastly, hepatitis E. This has a similar fecal-oral route with hepatitis A. This is also an acute infection that is preventable by vaccine. Yet, the main difference with hepatitis A is that if this infection occurs in a pregnant woman, the infection may become fulminant with high mortality rate. That wraps up viral and non-viral causes of hepatitis. Another organ in the hepatobiliary system is the gallbladder, in which the inflammation to this organ is called cholecystitis. Cholecystitis can be classified as either acute or chronic. In our case, we will discuss the former. There are two general etiologies of an acute cholecystitis: calculus and acalculus. Acute calculus cholecystitis comprises 90% of cases and is due to obstruction of the neck or the cystic duct by a stone. Gallstone or calculi formation is precipitated by supersaturation of cholesterol and combination of calcium salts with different substances making up pigment stones. On the other hand, acute acalculous cholecystitis has no stone involvement and is due to ischemia of cystic artery, an end artery with no collateral circulation. It is believed to be due to different causes that could bring about ischemia, like sepsis, immunosuppression, major trauma or burns, diabetes mellitus, and certain infections. Both calculus and acalculous etiologies bring about different manifestations. Murphy's sign being one of the most common, in which deep inspiration or cough during subcostal palpation of the right upper quadrant usually produces increased pain and inspiratory arrest. Management of acute cholecystitis is mainly via surgical intervention with pharmacologic aid of meperidine and NSAIDs. Lastly, an inflammation to the pancreas manifests as pancreatitis. Acute pancreatitis has multiple etiologies, including gallstone formation, alcohol, and hypertriglyceridemia, to name a few. These causes activate intrapancreatic digestive enzymes, namely amylase, protease, and lipase at the pancreatic acinar cells. Normally, these enzymes are activated within the lumen of the small intestine. Activation of the enzymes in the pancreatic parenchyma will cause both acinar cell injury and fatty necrosis, causing the release of bradykinin peptides, vasoactive substances, and histamine. These activities now will result to the clinical manifestations we see in pancreatitis, such as Cullen's and Turner signs, jaundice, and abdominal pain. This can further complicate to SIRS, ARDS, and MODS. Management of acute pancreatitis includes fluid resuscitation and nutritional therapy with assessment of its severity to keep in mind special considerations. That brings this presentation of the different hepatobiliary disorders onto a close. With the three organs we covered, we want to focus on the liver, specifically the alcoholic liver disease. And since we have already discussed the disease process, we advocate against alcoholism with the slogan, "Hubog na atay, makapatay."
An alcoholic is defined as a person suffering from chronic continual drinking of alcohol, characterized by frequent episodes of intoxication and the use of alcohol despite adverse consequences. Alcohol dependency, as defined by the Department of Health, is a chronic mental disorder marked by a craving for alcohol, while alcoholism is defined as an addiction to the consumption of alcoholic liquor or the mental illness and compulsive behavior resulting from alcohol dependency. In 2016, data shows that males 15 years old and above consume about 25 liters of alcohol in a year, while females 15 years old and above consume about 9.1 liters of alcohol in a year. More so, about 28% of males and 57% of females said that they have not consumed any alcoholic beverage in their lifetime. Per 100,000 15 years old and above, 21.1 males and 6.3% females suffer from liver cirrhosis. There are about 4,431 numbered deaths due to liver cirrhosis from alcohol consumption. There are other complications due to alcohol consumption, such as diabetes and pancreatitis. Anxiety, depression, employment status, and quality of life are just few of the things that come with people with alcohol-related diseases. Although there are risks of alcohol consumption, there may also be benefits if one consumes it in moderation. It lowers the risk of cardiovascular diseases, lengthens lifespan, improves libido, helps in preventing common cold, and lowers the risk of diabetes. We chose this as our advocacy because most people nowadays drink for a lot of reasons. These people are composed not only of adults, but of adolescents and young adults. Frequent drinking of alcoholic beverages becomes a vice. Because of this, we chose Hubog na Atay Makapatay as our theme for our public health lecture. We then chose Emily Homes in Makanhan as our audience because the president of their homeowners association raised his concern regarding the drinking habits of some residents in the area. According to him, the residents of Emily Homes drank alcohol as a form of bonding with friends and has become a form of recreation. Our group organized this public health lecture to be interactive, enjoyable, and fun. Aside from the lecture we conducted, we had games which assessed the retention from the lectures. We not only invited adults, but children too. This is to at least help them with their future decisions regarding drinking and for them to become responsible residences of their area. All in all, makadaot ba ang pag-inom? Walay ilimno na makadaot kung muinom sa kasarangan. Ang makadaot kayang sobra nga pag-inom. Magkahiusa kita kontra sa alcoholism. Hubog nga atay, makapatay. Kini nga pahinumdom gikan sa SGD 10.